Many rural communities in Ghana are underserved when it comes to access to good quality healthcare. Currently, Ghana has an estimated population of about 34 million people. Nearly half of the population live in the rural areas. The question is, how can we improve access to good quality healthcare for our fathers, mothers, siblings, and extended family members who live in these underserved rural communities? The OKB Foundation is making strides to bring healthcare to the doorsteps of rural underserved communities. Hello, welcome back to the channel and thank you so much for tuning in again. I am bringing you another story from the African diaspora, and my guest today is joining me all the way from the United States of America. Osei Boateng, you are welcome to the channel.
Thank you so much, Ms. Rachel, for this opportunity, and I'm so excited to be here.
Just start by telling us a bit about yourself, what you're doing in the US, what is your job role, and how long you've been there for.
Yeah, definitely. So my name again is Osei Boateng, born and raised in Ghana. Lived there for the most part of my life and migrated to the US with my family in 2014. And so next year would be like a 10-year anniversary in the United States. Currently, I'm pursuing my master's in business creation and also running my nonprofit OKB Foundation in Ghana. So that is what I'm currently doing.
When I saw the projects that you are involved in, which you will tell us more about later on, when you told me that you are not a clinician, you don't provide direct patient care.
That's right.
But yeah, all the things that you are doing, it's all geared towards healthcare delivery. What would you describe as your greatest achievement in your whole career?
That's a very good question. So for me, as you said, running the nonprofit and we deliver medical care, which I guess I'll talk extensively about that later. So for me, the ability to, serve rural and underserved communities, I would say, is the greatest achievement for me to be able to serve people who otherwise wouldn't have access to healthcare.
What inspired you to give back?
I was born and raised in Ghana, and I grew up in a community where access to healthcare was a challenge. People had to travel, several miles to the nearest hospital. Mm-hmm. And even if they get there, it's with the hope that they get to see a doctor. It wasn't a guaranteed thing that once they get to the hospital, they see a doctor. So a lot of people, ended up going there, spending a lot of hours. Others realized that, it wasn't worth the distance and the time, so they wouldn't even go. And so growing up, I saw a lot of people lose their lives due to, diseases that could have been easily prevented if they had access to healthcare. And personally, I lost my grandmother and my auntie due to this inefficiency. So growing up, I really knew that I wanted to do something to really address the health challenges or disparities, especially in the rural and the underserved communities. So, my lived experiences in Ghana was the driving force for me starting with OKB Foundation to bring healthcare to rural and underserved communities.
That is so amazing. When you were describing the scenarios, I can just visualize that so many scenes that I've seen, going to Ghana myself, where you see some poor old man or old lady who's come to the hospital. They are sitting on these long queues. And then sometimes people will come and bypass them and they will be there the whole day. And it's so discouraging for them. I know that some wouldn't even bother coming to go through all that hassle. So that's a needed service that you are providing. So tell us about the project.
OKB Foundation, really a nonprofit that is, our vision is to make healthcare accessible to all, and we are specifically focused on rural and underserved communities. So what we do is that we have a mobile medical van, that we use and travel to these communities. And so the van is pretty much a one-stop, health, center. So we have point of care lab diagnostics, We have physicians who goes with us. We have a nurse, a lab technician. So, I mean, once we move to a community, what we do first definitely is to make sure that we are working with the health directorate or the local health center who is there, so that they know that, I mean, we are around. And secondly, we are really also passionate about health education, because we believe that, I mean, knowledge is power. And also, if people get knowledge about different health diseases, they are able to, I mean, really modify their lifestyle, really modify their lifestyle choices to be able to prevent, or even if they have the health disease, they are able to manage that. And so once we go to the community, we start with health education, and we educate the community, and then we start with our health outreach, or basically health screening, where individuals can come to our mobile van, and then they would be met. First, they will go through our data analysts who will collect their demographics and then come to the nurse. The nurse will check the vitals, and also, depending on the situation, would refer the patient to the doctor who will be in the van. The doctor will do the consultation. Depending on the patient's condition, if there is any lab diagnostics that needs to be done, I mean, we do some of them in the van. So we have about 7 point of care lab diagnostics that we do, ranging from hepatitis B, C, HB tests, sickling tests, urine analysis, all the STI. So we do all these in the van. So depending on the patient's condition, we are able to also do a point of care lab for the person, which then allows the physician to be able to do proper diagnosis. And if the patient needs medication, we also do have medication in the van that we are able to also give to the patient. So it's pretty much a one-stop shop, health clinic or health center that moves to rural and underserved communities to provide them with health care.
Yeah, so it's healthcare at your doorstep.
Basically, yep.
So how long have you been doing this?
Yeah, so I started this nonprofit 2017 when I was a junior in college. So during my third year in college is when I started a nonprofit, and been going back to Ghana since 2017. I mean, going to similar rural communities, doing that. But as of that time, we didn't have the mobile van. So we usually go with a van packed with our medical supplies and everything, and we go to the communities. So I guess I'll backtrack a little bit and even tell you the reason why we even started the mobile van. So in 2020, right? Right before COVID, I went. Yeah, I went to Ghana, and definitely just, sometimes I like to speak with the people that we serve, trying to understand whether, I mean, the services that we are providing is of an essence, of a value to them, and trying to understand their pain points, right? And so speaking with them, I quickly realized that a lot of people, in Ghana, we have a very huge semi-informal market, which means a lot of people have their own small businesses, like selling by the roadside, selling in the market, in the rural communities. They are going to the farm. And so for these people, they don't have the luxury of time, because whatever they sell in the market determines the amount of money they get at the end of the day. That determines the food that they can put on the table for their family. And if the person is a breadwinner, like it is a different ballgame for the person, right? So for them, they don't have the luxury of time. So going to tell someone who is selling the market, who is a breadwinner, telling you that, you know what, you need to go to the hospital, even though they have money, like they wouldn't go, because they were like, you know what, if I go, there's no guarantee that I'll get to see a doctor. So that means if I'm spending 8 hours at the hospital, that means 8 hours of sales that I'm foregoing, which means at the end of the day, I might not have food to give my family. And that was the death of the mobile. But I was like, you know what if we have, a solution whereby we can take it to them taking 5 minutes, 10 minutes of their time from the market, from the farm, coming to the van, would be a whole game changer. So that is when we started with the mobile van idea, that we want to bring the healthcare to them. They don't have to come to us. And that is how the mobile van started. When we started, as of that time, I was still a student, so I didn't have a lot of funds, right? And I remember going to these marketplaces and telling them that, you know what, a year by this time, we are going to bring a mobile van. So in 2021, we did a fundraising to raise some funds to purchase the van. I personally contributed to it, definitely. I have been doing that, since we started in 2017.
Yeah.
And one of our board members, who I definitely have to mention on every sort of, opportunity I get to talk about this project, because he has been, a very significant, person who has helped the foundation a lot. And I would say later, probably a destiny helper who has really pushed us to where we are right now. He's called Sandy Khan, and he and his family has been a very great, help to our foundation. And so he used his 50th birthday to really help us do the fundraising for us, and even contributed to that. And so that really helped us get the amount of money that we wanted to purchase the van. So we purchased the van, we put solar panels on them, and also we had an electronic medical record installed in them, so that whenever we go to the communities, whether they have light or no light, we are able to provide the care, able to collect the data that we need. So in 2022 is when we started operating, right? So we went to the Ministry of Health. We spoke with them that we want a list of communities that don't have any health facilities. So they gave us a list of communities that don't have health facilities. And then, we started working from that list. And so since, operating 2022 up till now, we've been to over 50 rural communities and serve over 4,000 individuals, across these communities. And as we are serving them, we realized that it's not enough to do the mobile van. We started, training and educating passionate community members, who are really passionate about healthcare. And then they became an extension of us, so that once we are not in the community, they have the blood pressure machines, they have the glucometers that they can do follow-up care, report the data to us for us to be able to follow up with people in the community. So that is how the project started, and that is how how it is going. And as we get to serve people more, learn more about that, we also realize that, a lot of people come to our van would have a physical sort of illness, and once you start talking to them, you see that there's an underlying mental health thing that they are going through, right? And so that made us start another mental health initiative called Unhuhiame, which in the local language it means I care for you. And so with that initiative, our goal is that we want to integrate primary care with mental health, so that, people that come to our van for primary care can also have access to mental health care and provide this holistic care to the people that we serve.
Yeah. I can see your passion for this. It's exuding from how you're talking about it. And I think that's key to do this kind of work. And there are two things I wanted to pick on. You mentioned about funding and even sometimes using your own funds and destiny helpers. And one thing I realized with this kind of job is there's a lot of sacrificial work in terms of funds and your other resources, that if you don't have that trait, it's going to be difficult to do this kind of work. You've got to sacrifice time. You've got to sacrifice funds. You've got to sacrifice, so many things to be able to make an impact or influence society for good. And also, I'm sure you get cases where you may need to refer for further treatment or assessment. Is that right?
That is right.
Yeah.
So I would say so far we've had about 3, cases that we had to refer. One, we went to a rural community. The mom came with, her baby. The baby had hydrocephalus, and we're just like, we can't treat that in the van. So we asked the mom, like, what, like, that the child had this, like, why are you staying home? And it was like, I don't have money. I'm a single mom. I'm 18 years. There's no way I can do that. So I was just hoping that, like, the child would die one day, because there was no help coming anywhere. And so once we went to the van, because the good thing about the van is that once we go there, we are able to really interact with the people, see other socioeconomic factors that contribute to, like, their decision of not, seeking healthcare. So, backtrack to the mom story. Like, once we got to know about her story. We knew that we couldn't do that in the van, but that doesn't mean that we have to leave the child. So then we had to arrange, for the mom to be seen at the Confirmation Teaching Hospital. Where we had to, speak with some doctors there. Because the child needed surgery to be done. So we were able to do that. We footed the hospital bills for the mom, and did everything, and then got the surgery done for the child. And when I was in Ghana this summer, I got the opportunity to meet the child and the mom, which was a very fulfilling experience. So that is one story. Another story was the same, was a mom and a child. The child had issues with her kidney. And also we were able to, work with other doctors in the secondary and tertiary hospitals to be able to treat the child. And so when I went to Ghana again, I was able to see the child and the mom. So just to say that once we go to a community and the things that the people need exceeds what we can do with our van, we don't leave them. We make sure that they are able to get the appropriate care that they need.
So you are in the USA. That's where you live. And
correct, for the most part.
You are executing all these projects in Ghana. How do you do it? I'm sure there's a lot of partnering, collaboration, networking. How do you do it? Because the issue of migration and development, the brain drain, the African diaspora, there's been calls for us to go back home and help with whatever area that your expertise is. We know people go back, physically move to Ghana and start doing things. But you are in the US and you are doing a lot. So how do you do it?
Yeah, that is a very big question. To be able to do that, for me, it has been the team that I've been working with. The amazing group of people who are really committed, to the vision of the foundation. And they have really been the people that have been running the behind the scenes things for us. And so I would say is the team. And also what I've realized is that once you are able to really communicate what you are doing to other people jump on it. And so for us, volunteers who come along are people who would like to, serve rural communities, because what we realized was that, a lot of people, love to serve communities like that. It's just that they don't want to stay there, right? So they would love to go there, serve, and come back home. So since our van gives them the opportunity, they jump on this, and they are able to go with the van, to serve them. But at the core of it, I would say that is the team that I have in Ghana who are really pushing this forward.
Kudos to your team. This is what you need, especially if you are not, resident in Ghana. So in all these, what are some of the challenges you face, or should I say opportunities? Because sometimes the challenges are opportunities for you to, improvise or come up with innovation. So whichever way you see it, whether challenge is opportunity, how have you, encountered these, and how have you managed it?
Yeah, so for us, definitely one has been, some of the challenges is being able to raise enough funds to really amplify the work that we are doing. If it was only for me, we would love to run this like 24/7, go into communities, but definitely we have to also acknowledge that we are limited by the resources that we have. So there's so much that we could do. And so I guess one of the challenge has been the funding opportunities to really, push this project forward. The second one has been definitely mostly it's operational. A van is a machine. Sometimes you try to, move it, it will move. So, you have to really improvise. That was one of the reasons why we started training people, because we just didn't want to say that, okay, the van is not coming, so no healthcare. So we wanted to create a system whereby either there is a van or no van, people will get access to healthcare. So, some of the challenges have been the operational ones. And the third one is being like the regulatory bodies. Definitely, when we started off, I mean, there wasn't any sort of, that what a clear cut for people operating mobile medical clinic in the healthcare system in Ghana. So it was a challenge trying to, work with the healthcare, regulatory bodies, because definitely it was something new that people, no one is doing that on a sort of a foundation level or a private level. So those were some of the challenges that we encountered. But we spoke with them. They were very understanding. They worked with us and definitely gave us the green light to be able to do so. So yeah.
Yeah. So one of the good things that I realized about your foundation is you're not just giving back to Ghana in terms of delivering, care in the rural areas, but you are taking like students from your institute to go there they learn. Tell me a bit about that.
Yeah. I started. So I started this whole Experience Ghana program. That was during my senior year in college, and that is after I did my project in 2017 and came back to school. I told people about what I did, and so some of the students really were inspired and they wanted to go. So 2018, I brought my first set of students as a student to Ghana, and there were 3 of them, and definitely they were exposed to the global health, the healthcare situation in the rural communities. They helped out with the health outreaches. They were able to shadow physicians in the healthcare institutions in Ghana to really understand how healthcare is being delivered. And also, they got to immerse themselves in the culture, trying to learn the culture of the people. So, I started this initiative just to also expose other people to, the other world, and also how healthcare is being delivered in rural and underserved communities, because definitely it's different when you're in the rural community versus when you're in the city, and even different when you're in the United States. And I feel like a lot of people, take things for granted, which I wish they are in the rural community to see how people struggle to even get a malaria test done, or get a malaria diagnosis. So I've been doing this since 2018. 2018 I took people. 2020, right before COVID, I took about 10 students with me, and COVID happened, and then 2022 I resumed taking students. So overall, I've taken about close to 20 students to Ghana every sort of winter and summer, so that they also have experience on like how healthcare is being delivered. For some people, it's a learning experience, because then it helps them with their perspective on life. Like, I'm really fortunate to what I'm having here versus like what I saw there. So my goal with that program was to, one, educate people about the different sort of healthcare situations people are facing in the real world, and also for them to also learn how to be able to provide compassionate and empathetic care, because once you're able to do that, you feel for the people. So it even helps you when you're treating other people, even in your professional career.
It's really great that you're doing that. So can anybody join? Let's say if a healthcare professional in UK, Canada, or US, and then they are in Ghana and they want to come and help. Is that possible?
Oh, of course. Definitely that is possible, right? So for us, we know that we cannot do the work by ourselves. Definitely limited by human resources. So even if we go to the communities and we don't have enough human resources, that means we are not able to serve the number of people that we would love to serve. So for us, we are really open. So whether you are from the UK and you're in Ghana, from the US in Ghana, even from Tanzania and you're in Ghana and you would love to really serve, definitely our hands are open. We always welcome people, volunteers to help us, because the more the merrier.
So just to confirm, how many regions are you working in now? Which regions have you been to so far?
Primarily we operate from the Ashanti region, but we've gotten opportunities to collaborate with other nonprofits in different regions. One being the Amazing Grace Charity, charity where they are really focused on maternal and child health and how to improve that in the Greater Accra region. So over the summer, we collaborated with them and we went to the Go Pram region or the Go Pram community to be able to provide healthcare together with them. So I would say primarily we operate in the Ashanti region, but once we get collaborations and partnerships, we just move to the different regions. Yeah.
That is so, inspiring to hear that. And I have a request. There is a village, there's a young boy who is advocating for services in his village for a long time. I think the place is called Akumesui Tea, somewhere in the Krobo Menya district. So that's my request. And you are around that area, don't forget Akumesui Tea. What advice would you give to other African diaspora who want to give back or do something back home? What advice would you give to them?
Yeah. So what I would say is that you don't have to have it all to start in making the change. Even with the small that you have, you can start something. And definitely it's also important that you network or collaborate with other people on the ground who have the lived experiences to be able to make that happen. And because believe it or not, you're going to work with them anyway. So it's good that instead of coming in with your own ideas, definitely it's important that you work with them. Even that you have your own ideas, they also have ideas that they have developed over the years. Serving in the country. So it's very important that you work with them as well and to make things happen, because you need them to make it happen. So the advice I would say is that you don't need to have like $1 million or 500,000. You can start with the small that you had. For me, I started as a student. I was earning any money way back in 2017, and now things are moving forward. And I believe that once you start, people will jump on it. You get a lot of helpers, supporters who believe in what you're doing, and eventually things will happen. But I wouldn't say it's easy. It's very difficult, a lot of sacrifices, a lot of disappointments. So it's not easy. You have to be really resilient and very tenacious, knowing that you want things to happen. Otherwise, you will easily give up. I would encourage anyone who wants to make a change on the continent that definitely they need your help. Like they really need your help. The government cannot do it alone. So it's very important that we also play our role in that, especially since we are exposed, to other opportunities here, learn something new. I would say for me, starting college, learning about the different cardiovascular diseases, learning about how they have silent symptoms, and people, if you don't know about it, you can die of it. That was the thing that really started. I got to know about this. I was like, you know what? I grew up from a community where getting to a hospital was a challenge, how much more getting access to blood pressure machines. So that was one of the reasons why I started this, trying to push this forward for people to know, create awareness. And now we are able to move with a mobile van to actually visit or go to more communities. So definitely I would say that with the knowledge that we've acquired here, it's very important that we also bring it back on the continent to make it great again, because that is our home. And it's always an honor and a privilege to serve people, especially those who, cannot repay you back. It's a different feeling when you serve people where you are not expecting anything back from them.
That's key. We will persevere. We will persevere. Thank you so much. When is your next project?
Yeah. So for us, we ran throughout the years. I would say even last week we were in the rural community. We are planning a couple of communities in November. So we are just running throughout
every
the year.
Day,
so I would say every day there is something. But I think one of our main projects that we are working on, or we are planning to go to, is one community that will be in November. Because before we go to even communities, we have to do some background survey. We have to go there. We have to speak with the health directorate. We have to work with the local health center. We have to inform, the community members. So there is a whole sort of things, checklists that we go through before we even go to the community. So currently we are doing that for one community, and our goal is that by the end of the week or next week, we should be done with that part of it. And then the first week of November, be able to go to that particular community to provide care. So, I know that there is another bigger project that is coming up in January 2024, where we are going to work with the Nursing Alliance, the Diaspora Nursing Alliance.
Ghanaian Diaspora Nursing Alliance.
Yeah, the Ghanaian Diaspora Nursing Alliance, where we will be taking healthcare to the Amina area in Cape Coast, Central region. Yeah, so that is another thing that we are working towards. So but apart from that, we just run every single day. So yeah.
Hi, Osei Boateng, thank you so much. This is on a different level. I've often interviewed healthcare professionals. I'm doing things, but you are the first person who is not a clinician, but you are doing a lot in terms of delivering care. So thank you so much, and I wish you well in all your future endeavors. And I sincerely hope that whoever's watching this video will be motivated and encouraged to be able to take action as well in terms of giving back. So thank you for your time. What's your social media handles, or where can they find you online?
Yeah, definitely. But before even I jump into that, I would also want to thank you. For this opportunity and for this platform. For me, it really means a lot because one, we know we cannot do it alone. Two, we believe that other people can learn from the work that we are doing and be able to replicate that. And that is the goal. We know that the pie is huge. We can't do it alone. So we need more collaborators, more people, to be able to replicate what we are doing so that we can provide care to a lot of people, not only in Ghana, but across the continent. So, thank you so much, for this opportunity. People can learn more about the work that we do too on our website, which is okbfoundation.org. Definitely, we are open, whether they want to volunteer, whether they have some medical equipment, supplies that they will have to donate, or whether they know anyone that would be willing to support the work that we are doing. We would really, really appreciate that. But most importantly, we need, people who really buy into this vision to make this really, something big that we can serve a lot of people.
Thank you. Thank you so much for your time.